Viewers and pharmacists, Assalamu alaikum. Today I am going to share with you some roadmap and way forward that has been already approved and recommended by the WHO through a series of workshops as HRH strategy framework, which has been undermined, in my opinion, by the current Minister for Health. Perhaps this was strategic framework was framed in the year 2016 to the then government of the Pakistan, Tehreek Insaf, and he is in the new cabinet, so he may not be having this document. Rather, he is having this document, but he may not be presented to him. So I request the Minister for Health and Prime Minister Imran Khan to keep into consideration these points that have been suggested through a series of workshops through the WHO and the Khyber Medical University for uplifting of the healthcare system of the Govt of KP, and now of course for the Islamic Republic of Pakistan. Let me introduce myself. I am Professor Dr. Niaz and I'm working as Professor of Pharmacology, and I'm PhD CHP with Master in Medical Education, and I'm a member of the American College of Clinical Pharmacy, member of the American College of Clinical Pharmacology, and a member of the American College of Clinical Pharmacology Academic Committee as well. So I'm involved in the strategic documents, especially with relate to academics. And you can follow me on YouTube, that is with name of Professor Dr. Niaz Lectures. So object of this presentation is to give inputs to the Minister for Health of the Govt of KP, and of course the Prime Minister of the Islamic Republic of Pakistan as Minister for Health in his latest press release in the that held on 18th April 2019. So my dear Minister for Health, there are some points for you that how to proceed and how to uplift the healthcare system. And I think we have undermined a particular profession. Once we were students, we were taught by medical doctors that there is doctors, pharmacists, and nurses. This trilogy has been in practice in the United Kingdom, and it is very clear to those doctors that who have worked in the United Kingdom or in the United States of America. Now, the terminology has been changed from these physicians to doctors, and unfortunately the problem of doctor and non-doctor has been erased. But it is not the matter of doctor and non-doctor, it is the matter of professionalisms, and that's a separate story which requires details discussion. But nevertheless, this trilogy is very important in a key healthcare system. So I request the pharmacists and of course the Minister for Health that the key points are that self-belief, self-esteem, and of course self-regulation. And I'm very happy that he is looking forward for the points to be given to him. Now, what is important? This is the documentary evidence that this document was framed through WHO, through the government. This is their own documents of the then PTI government, which was framed in series of workshops at Pearl Continental Hotel Peshawar, and myself was a member of that committee, and it happened through a series of workshops. Thus this activity is being documented on the will of the then government of the Khyber Pakhtunkhwa, which was PTI. So it is a composite document and based on the data. So there is no need to go into the purpose of this detail, because the detailed documents the minister can find, I can send him, or it is already been sent by the WHO to the provincial government. And you see, the purpose of this was HRH strategic framework plan, which he refers to in his recent press conference. Now, having said that, I have taken some screenshot from this, and the current alarming situation, that is the pharmacist probability and the pharmacist proportion value is very, very negligible, like nurses and paramedics, you see. So these were the SWOT analysis, some statistic and figures, this is clearly mentioned in that particular document. And this slide is representing the SWOT analysis. SWOT analysis, you see, strength, weaknesses, and opportunities, and these are all the weaknesses, you see, and the threats. So one of the threats is that there is a poor linkages of the healthcare system and the health education with department like pharmacy education is not with health, though its services are with health. So the first key to success for the Minister for Health is that bring the pharmacy education under the health, like Khyber Medical College is though settled at the University of Peshawar campus, and their employees have occupied the houses of the University of Peshawar, but still they are on the payroll of the health department and nobody is expelling them from their houses. So what I request, as per the domain of the health, medical university, all these pharmacy departments shall directly comes as affiliated institutes for the examination body through the pharmacy council, when it's come to the Khyber Medical University, or there should be an alternate possible pathway. Now, the second important point is that there is no practices of clinical pharmacy, in the hospital, and this is an alarming situation, especially in technologically advanced countries like UK and USA. There is clinical pharmacy practices. People may misguide you, my dear Minister for Health, that the already employed pharmacists are clinical pharmacists. No, there can be clinical pharmacists provided we give them certain residency training program. So don't be misguided through these colleagues, and let you may have a plan. This is also a screenshot highlighting this, that the governance of HRS, the purpose. This document is with you in your office, and there are certain training and level have been recommended, and in service training and continuous professional development has also been recommended. And then, of course, the strategic objective and framework has been framed based on the previous slide. We performed the SWOT analysis where the strengths and weaknesses were identified. So you see, this is at page number 21 in that strategic document. You see, one of the recommendation is that weak discipline like pharmacy, physiotherapy, and nursing, these should be uplifted. Second is why the rationale is that there is no clinical pharmacy practices in Pakistan. You see, there is no clinical pharmacy practice in Pakistan, like rationale of the previous pages here. No clinical pharmacy practices in Pakistan. This is how the WHO and all the key stakeholders of the teaching hospital have been agreed with. So what is way forward? Way forward is, my dear Minister for Health, to start the pharmacy education should come with health. These are the strategic framework being suggested to you, your portfolio, through that particular WHO workshop, and agreed with the then DG Health and the then Minister of Health. They all agreed with this. So my request, humble request, is to start the clinical pharmacy practices as per the international standards, and the provincial government should come with a proposal on the analogy of technologically advanced countries like UK and USA for the start of clinical pharmacy services in teaching hospitals. As I said, this should be on the as per the practice in technologically advanced country like USA. But what is way forward? The KMU shall come. The KMU should come with its own college of pharmacy as role model, because we have what you can say, memorandum of understanding with the University of Glasgow, with other good universities in the United Kingdom, and then we can start the clinical pharmacy program with through the consortium with these universities, and these pharmacists may be trained there as a postgraduate diploma in clinical pharmacy or in 1-year master in clinical pharmacy program, and then they shall come and start the clinical pharmacy program in the teaching hospital of the province. So this is way forward, my dear Minister for Health, and if you need any help, my help is always there as a member of the American College of Clinical Pharmacy, as a member of the education committee of the SCCP USA, so we can give you certain insights. This is an eye-opener slide for the pharmacists and of course for the Minister for Health, that short term, you see, the 2016 and 2018, and the medium term policy is, so this policy documents goes till the end of the year 2026, and if it is in the beginning, if clinical pharmacy is ignored, so it will be very difficult for you, my dear Minister for Health, ignoring the clinical pharmacy, ignoring the pharmacy practices, and it will be just like a lingering on healthcare system. So a lingering healthcare system cannot deliver. So my humble request is that the government should start the clinical pharmacy practices on the analogy of technologically advanced countries like UK, USA, or American College of Clinical Pharmacy. Details are today being shared on my Facebook wallpaper, and that is this. You can just follow this. Pharmacists can follow this link.